Welcome to SVG-TV News for Thursday, October 8, 2020. I am Rochelle Batiste with the details. SVG has recorded 5 and not 6 dengue-related deaths, as has previously been announced. In a news release today, the Ministry of Health, Wellness and the Environment said one person who was previously classified as having died from severe dengue fever has been determined to have had dengue fever but died from other causes. No new deaths have been recorded since the last reported case on October 1st. The ministry said there are some 665 laboratory confirmed cases of dengue fever in the country as of Tuesday, October 6, 2020, and that persons who lived in the Kingston, Calico and Pembroke health districts account for 64.58% of these cases. The majority of affected persons, 69.47%, is in the 25 and under age group, with 52.98% being in the 15 years and under. The ministry said all healthcare facilities continue to report an increased demand for care by clients presented with symptoms and signs consistent with dengue fever. It has activated that part of the National Health Multi-Hazard Response Plan, which deals with abnormal viral diseases, which are diseases caused by the bite of infected insects and ticks, and surge capacity measures have also been implemented. These measures include increasing the health staff, reducing elective admissions, and increasing admissions capacity. The ministry further said that it is essential medical stores utilizing the emergency supply chain system has ensured that the increased demand for all treatments and supplies required for the management of all clients seeking care has been consistently met. And Minister of Health, Wellness and the Environment, Luke Brown, today delivered a ministerial statement in Parliament on the dengue outbreak in the country and the government's response. He said the past few months have been an exceptionally challenging time for health, not just in St. Vincent and the Grenadines, but the world over. He said despite what some persons may say, the Ministry of Health was not caught off guard with the dengue outbreak, as they have always been on their guard and have mounted a strong response.
Contending with something which was anticipated by regional organizations, for which we were prepared and to which we are responding in a very strong way. Mr. Speaker, we regret any loss of life from any health condition, and I extend my condolences to the families who have been affected. I have been able to speak to some of them myself directly, and I could understand their difficulties. If we are to look at the literature, we know that a certain percentage of dengue cases are expected to progress to the point where individuals might need clinical attention. And we know that there is a certain fraction or portion of cases that unfortunately might end up in persons dying. And we try to minimize that to the extent possible.
Speaking on what has been taking place medically to deal with the outbreak, Minister Brown said they have boosted the capacity of the health services to respond, which include taking on board additional doctors and nurses.
We focus considerable attention at what happens at the accident and emergency department. But if truth be told, we need to have capacity throughout the health system, because persons will show up and have been showing up at the Modern Medical and Diagnostic Center. Persons will show up at the Bookament Polyclinic. Thank God we have a government that saw the wisdom of putting a polyclinic at Bookament. Persons would show up at the Levi Latham Health Center. Persons would show up at the Chateaubelair Smart Hospital. And we have a healthcare plan or infrastructure in place that helps to address the health needs of our population. And that is in part part of the reason why we would be able to deal with this outbreak with minimal damage to the health of our nation.
Noting that they are doing all they can to prevent additional dengue-related deaths, the health minister said the most effective response to dengue is that of the whole country working to eradicate mosquito breeding sites.
And Mr. Speaker, I should say that we at the ministry, we are overwhelmed with the response from volunteer groups and organizations who have said, I believe I could do something to help my country at this moment, and have in fact been helping the country by implementing certain volunteer activities. And I want more persons, through formally established groups or through ad hoc arrangements, to come forward and say, I am prepared to do what I could to eliminate mosquito breeding sites. Please deploy me as you see fit.
It was also pointed out by Minister Brown that there is no charge for dengue fever tests and that all supplies are on hand to continue testing without any implementation of user fees. Several private doctors and health institutions have reportedly seen a high intake of dengue fever patients at their clinics on a daily basis. And the Advanced Health Medical Clinic in New Montrose is among those witnessing increase. Dr. Conrad Ned told SVG-TV News that he started seeing an increase in patients with dengue fever from as early as June. His clinic has since procured a rapid test for dengue fever, which is used on patients, but they are still encouraged to have a laboratory test done. Dr. Ned said that on a daily basis, he clinically diagnosed more than 10 persons with dengue fever.
What has happened is that we've had a number of patients come in that way. Sometimes on some days we will see over 10 patients with symptoms that are suggestive of dengue. Usually fever and headache would be the main complaints, but then many of them would have additional complaints like body pains and so on. A few of these patients have had cough and cold associated with their illness, and we had those patients screened for COVID. We encouraged them to contact the hotline, and they've been tested, and the COVID tests came back negative. We've not recorded a single case of COVID-19 when we encourage a person to be tested. We are seeing a significant number of persons coming in with fever and headache, and that has caused us to have to deploy some additional resources as well.
Dr. Ned said that because of its location at New Montrose, the majority of the clinically diagnosed cases are from the leeward end of the mainland.
Initially, all of the cases were coming up from the leeward side. In fact, we had cases coming from Vermont area, Rillan Hill, Pembroke, Bookament, and then we had cases coming in from Camden Park. I think that the hot spot that we saw was Camden Park, and then as soon as Camden Park became a hot spot, we started seeing patients from the other side of the island, from Rathamil and Prospect and Brighton, and then it was just from everywhere. People were coming in from Arnhim and New Montrose and so on. So I would say that we saw it begin on the leeward side, we saw it spread through the leeward side, and then we saw it everywhere.
Dr. Ned said while many patients do not take the laboratory dengue fever test, some do return with the results having taken the lab test.
Patients who may not do the test. Well, they would have the option of going in if they want to. They can have the option of going down to the Milton Cato and doing a blood test and having it checked. Right, but we don't have feedback on every patient in terms of whether they've been confirmed or tested. But certainly in terms of suspected cases, we've seen more than 100 suspect cases.
Breast Cancer Awareness Month is usually observed in October, but here in SVG the activities will be scaled down due to the COVID-19 pandemic. President of the SVG Medical Association, Dr. Roslyn Ambrose, told SVG-TV News that there will be no pink cap walk as is customary. However, there will be a day called Pink Day where all persons are asked to wear pink.
Because of the COVID-19 pandemic, we were just inviting the general public to join us on a pink day, which would be next Friday, the 16th of October. We are asking everyone to just wear pink on that day in honor of the ladies who have passed and the awareness about breast cancer, which is an ongoing issue for women across the world, including people in St. Vincent and the Grenadines.
While there will be no major event this year, Dr. Ambrose is encouraging all women to do their breast self-examination and get a mammogram done for early detection. She reminded that breast cancer is treatable and every woman needs to know the symptoms and be aware of changes in their bodies.
The same that we do every year to encourage women to do self-examination. Easy to do when you're in the shower. We encourage women who are 40 years and over to consider having a mammogram. We also would like to encourage women to be more aware of any changes in the breast and to seek medical advice if they're concerned about their breast health. So really the awareness, the public education remains the same. We keep reinforcing the message year after year because it is an ongoing problem.
Dr. Ambrose added that families and relatives of persons living with breast cancer can also do their part by helping their loved ones cope with the disease.
Those people who already know they have a family history, this is a good time to update your medical information. So we keep the message is the same. Sister organizations who usually come forward to participate in our activities. We would like you to, if you've got a club shirt that is pink because of breast cancer awareness, we encourage you to wear those too and to keep these women in your prayers. And we would still like to, we have a low fundraising this year because of the pandemic. Of course, we're not having the sale day, but we still have the breast cancer pins so people can come and purchase these here at the Imaging Center. And try to still be sensitive, be supportive of people who you know have the disease.
In other news, Minister of Education Sinclair Jimmy Prince took the opportunity in Parliament today to congratulate the nation's students for their performance in this year's CSEC and CAPE examinations. Minister Prince said despite the challenges presented by the COVID-19 pandemic, which led to a period of anxieties, students were able to elevate themselves and return outstanding results.
Are in order for the 11 schools that recorded percentage pass rates of 80% or more. These schools are St. Martin's Secondary School, Girls House School, 97.88%, St. Martin's 94.848%, Beckwith Seventh-day Adventist 94.19%, the St. Vincent Grammar School 93.32%, St. Joseph's Convent Kingstown 86.91%, Thomas Saunders Secondary 85.23%, Mountain View Adventist Academy 83.64%, West St. George Secondary 83.59%, and I'm happy about West St. George for obvious reasons. St. Joseph's Convent Mariacoa 82.68%, North Union Secondary 81.38%, and Georgetown Secondary School 81.15%. Of course, congratulations are in order for all of these the schools. 12 schools also obtained credible pass rates between 60% and 80%. At this time, Madam Speaker, I want to congratulate all of the top performers from the 26 secondary schools.
As he gets ready to leave public life, opposition member of Parliament for East Kingstown, Arnhim Eustace, received glowing tributes in Parliament today, mainly from members on his side of the House. Opposition leader Dr. Godwin Friday said he thought it fitting to thank Eustace for his years of service, as it may be his last sitting before the next general elections, which he had already indicated he will not be contesting. Dr. Friday said Eustace served with distinction during his 22 years as a parliamentarian.
One of public service. As the youngest permanent secretary in this country, serving governments to the best of his ability, for the benefit of all Vincentians, with professionalism, competence, dedication to service. These are hallmarks of the Honorable Arnhim Eustace. It's an example, Mr. Speaker, for all of us. And it's an example for young people who feel that public service may not be the thing for them, but to understand the importance of having people of ability, integrity, and commitment to give all of that in the service of our country.
Other members on the opposition side shared similar sentiments about Eustace, saying that he has helped to mold their political careers.
His integrity, his commitment to truth and justice will stand out over the trying periods of time to come as a unique and admirable trait. One simply has to recall,
in my limited political experience, there will be few political leaders that would be able to argue that they've been more robust and demonstrative in opposition politics than Mr. Eustace has been, beyond the shadow of a doubt. Bold and firm in principle in his quest for constitutional rule and democratic practices and traditions.
A man of integrity, a man of your word, and a man that St. Vincent and the Grenadines can be very proud of. I want to take this opportunity to wish you all the best in your retirement from public life.
My growth in politics and parliament is partly due to you. And I wish to thank you for all the advice and all the help that you have given over the years.
Mr. Eustace, I am here thanking you for the many hours that you have spent with me, preparing me for the political work which is ahead.
His name will go down in the annals of history of one of the most impeccable politicians St. Vincent has seen in terms of integrity and statesmanship. This cannot be gainsaid.
We have seen the best of a son of the soil, a father, a husband. Arnhim Ulrich Eustace, honorable gentleman, we thank you very much.
Government Senator Luke Brown, who has unsuccessfully challenged Eustace for the East Kingston seat in 2 general elections, also thanked Eustace for his years of service, noting that confirmation of Eustace's retirement from active politics evokes mixed feelings.
I thoroughly enjoyed the clashes that I had with him on the polls, at the polls before, and you noticed that, Mr. Speaker, we made particular progress in the outcome of our elections, and I was hoping that he would give me the opportunity for that last showdown, which no doubt may have resulted in his retirement anyway. Mr. Speaker, it has been further said that the honourable member is the long-standing, you may say, representative for the constituency of East Kingston, which happens to be my constituency. It means that he has been my representative for all these years. I wouldn't venture from the floor of Parliament today to comment on the fruits of that representation, but I really wish him the best as he moves into retirement.
For his part, Eustace expressed thanks to his colleagues for their tributes and said his only regret is that his family could not have attended today's sit-in as his request for them to be there was not granted.
We're very struggling in this parliament from time to time. The point is that our families are the ones who bear the brunt of the difficulties that we face. And I cannot understand why we couldn't have an opportunity for my family and one or two of my supporters, about 5 people in all, couldn't be here today to listen to this presentation that we have had from members of parliament on both sides. It's very important, Mr. Speaker. They suffer through all the difficulties that we have. And when we leave this place, at least we can give them the opportunity to be present at a time like this. I am deeply disappointed in that, Mr. Speaker, in that decision. They are the ones who bear the brunt of all that we face. And I take very strong objection to the fact that they are not allowed to come here, 4 or 5 people who represent my family and close supporters of the New Democratic Party in East Kingston.
The ban on amplified music was lifted on July 10th this year. And Deputy Commissioner of Police Frankie Joseph said that while that many applications were approved under the new protocols for amplified music and mass gathering, no one was found to be in breach of the protocols. And with political gatherings now being held, the Deputy Commissioner told SVG-TV News that permission has been granted on several occasions and applicants are presented with a copy of the protocols. Recently, there were 2 main political gatherings in the same constituency, but one was denied the application to play amplified music. Joseph explained that this was done, but was dealt with fairly.
So far, we have not had any problems with amplified music. We have not had any problems so far with political parties having functions. One of the things that we are conscious about is not to give permission for political parties if they are too close to each other. We look at the proximity in the area. For instance, last weekend we had 2 applications for functions in a district, but then the proximity was too close. So we approved one, the one that came first, and then the other one we did not approve that. But everything went well. Things are very quiet. People are adhering to the protocols that are in place.
Both parties will be having political meetings this weekend in the same constituency and have been given permission to use amplified music. Joseph said the police do not consider the meetings to be in close proximity of each other and no conflict is anticipated.
Okay, those 2 functions, the proximity is not as close as the one last week, but we have everything in place to take care of those 2 functions. Well, the time is not the same.
As it regards the wearing of masks by persons at these gatherings, the Deputy Commissioner said it is not mandatory and it is left up to the Ministry of Health to make that call.
Are applying all of the time to have functions, whether karaoke, blacko, and things like that. Things have been going well with respect to that. I really cannot remember that protocol with respect to wearing masks, because I don't think, if I can recall, that the Ministry of Health make masks mandatory. That is the Ministry of Health responsibility, so I will not be able to answer that part of it.
The protocols for the managed conduct of mass gatherings with amplified music is a collaborative undertaking between the RSVG Police Force and the Health Services Subcommittee. The protocols have been implemented in an effort to reduce the risk of persons contracting the coronavirus, and persons are urged to comply. The maximum number of people recommended for outdoor mass gatherings is 500, and persons must use face coverings. There should also be sufficient sanitizing stations conditions, adequate space to allow 3 to 6 feet physical distancing, adequate toilet facilities, and temperature checks done.